Michelle, welcome to the Drive Time News Hour.
Well, thank you, Jack, for having me.
It's a real pleasure. And I've enjoyed my acquaintanceship with Dr. Thome, and he's helped me a great deal with my eyes, and I know he hires well, and the staff there seems to reflect it perfectly. So it's great to have you on. And
Well, thank you.
and I've been told that one of your areas of expertise is treating macular degeneration. So the first question would have to be, what is macular degeneration?
Sure. So, macular degeneration is a disease typically that affects older folks that damages the cells in the back of their eye in the retina. And it leads to a dimming or a loss of vision in the central vision. So, people with macular degeneration have more trouble seeing faces, seeing things in the center of their vision or reading, but their peripheral vision remains normal. There's a couple of different types, dry and wet. That dry is the most common that we see, and that causes just a gradual thinning of the center of the retina that happens more slowly over time, whereas the wet form, that's less common, leads to leaky blood vessels or fluid and blood accumulating in the center of the retina, and that can lead to quickly worsening vision.
How common is it as a eye problem in your field?
Well, unfortunately, it is a very common problem and is something that one of the most common reasons that patients present to our office with problems with this central vision. It is actually the leading cause of vision loss in people over age 50. From the CDC, we have some statistics that say in adults over 40 in the U.S., 12 to 13% are affected by this at some point in their adult life. So it is really common, unfortunately.
Male, female, does that come into the
Both.
equation?
Both are affected.
And do you ever hear of cases of young people with it?
Not very often. No, no. There are other diseases that can affect the retina that happen in young folks, but this is more of an aging disease.
And what might be some of the first clues that is something that people should see you there at Eye Consultants of North Dakota?
Well, the very early stages of the disease are not detectable. So it's really important for folks to have an eye exam once a year, because if we catch the early stages, there are lots of things that we can do to prevent worsening and treat that more effectively than if we find it after somebody already has problems. But some of the most common things would be wavy or distorted lines. Like if you look at the line on the highway and it seems to wave, or a door frame or something that's normally straight, if it's distorted, that's concerning. Looking at a clock, somebody who has macular degeneration would maybe have trouble seeing the hands of the clock, but the numbers around the outside would be normal. So it's definitely central vision problems that people notice first.
We're talking to Dr. Michelle Atchison with Eye Consultants in Fargo. Boy, it really sounds serious.
Well, it can be. There's a wide range of vision changes that can happen with macular degeneration, from somebody not even knowing they have it and very, very slowly changing over time, to somebody that loses central vision very seriously and very quickly. So it's so important to detect this disease early.
And how is it treated?
Well, when we see the early stages of macular degeneration, we can use vitamins that are available over the counter. They're called AREDS2 vitamins, and those we know from the early age-related eye disease study that folks that take that vitamin when they have early stages are far less likely to develop the serious wet macular degeneration. So that's a combination of vitamins over the counter, easy to find and easy to incorporate.
Wow.
The other things are just general health tips that are good for everybody: wearing sunglasses or a hat outside to prevent UV exposure, eating a healthy diet with lots of dark leafy greens, colorful fruits and veggies, the fatty fish like salmon or nuts, those are important. Exercise and avoiding smoking.
Ah,
And then for folks that have the more serious types, like advanced dry macular degeneration, where they're losing some vision, there are really new medications available on the market just within the past year. That's really exciting because we haven't previously been able to treat that very well. So that's very new and something that can slow the worsening. And then the most common thing that I treat in my office is wet macular degeneration. So those are the folks that are having leaky blood vessels, fluid in the center of the retina. And we do inject medications that are really great at slowing that process down as well. So we have a lot of options to treat this. And the most important thing is that we find the people that need it so that we can help them.
wow.
We also work closely together with folks at the North Dakota State Services and the Minnesota State Services for the visually impaired. There's great occupational therapists and low vision optometrists in town that really help folks that have vision trouble use the vision that they have better so that they can optimize, daily activities, cooking, mobility, communication, those types of things that are really important.
Well, you've already answered the question that was texted in saying, how has the treatment of macular degeneration changed? And it's happening even as we speak, right in front of our eyes, isn't it?
Absolutely. And looking back over the past 10 to 20 years, the amount of options that we have for treatments for macular degeneration has really exploded. And so it's really promising for those people that are affected by this.
Dr. Michelle Atchison at Eye Consultants of North Dakota, 3171 44th Street South in Fargo. And I want to thank you very much for joining us here on KFGO. I look forward to meeting you someday.
Well, thanks so much for your time.